It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today I have an email from Diane who says, "Hi Patrick, the doctors are just writing my husband off in intensive care because of his previous stroke and bleed history, which was caused by a hospital anesthesia error, which due to lack of therapy has left him immobile, requiring 24-hour care. Although he is immobile, I feel that he is immobile due to lack of therapy as opposed to being immobile because his brain is not functioning properly. After 2 days in ICU, where they ventilated him on arrival because they said he wasn't breathing on his own, although prior to his ambulance ride, when he vomited again, his pulse oxygen was between 89 to 92%. So I assume more vomit went into his lungs as he has pneumonia, which they are treating. They are recommending a tracheostomy before knowing if he will be able to breathe on his own once the pneumonia resolves and before the blood from bleed is reabsorbed, when they could fully access his body's abilities to function properly." Thank you, Diane, for sharing your husband's situation. I'm very sorry to hear what your husband is going through. Now, I could not agree more with you that just before they're putting in a tracheostomy or even recommending a tracheostomy, they absolutely need to assess him properly. Now, what needs to happen here is this. I have done a video and an article, how to wean a critically ill patient off the ventilator and the breathing tube. And I would highly recommend you check out that video, and I'll put a link below this video in the written version of this blog. And here in that video, I go through it step by step, what needs to happen, how to wake up a patient, how to talk them through extubation, what they need to do, and so forth, right? Because from what you are sharing with me here, they are not doing any attempts to do that. They're just talking about a tracheostomy and, want to wash their hands clean without doing all the hard yards and all the hard work, which is often required to wean someone off the ventilator and the breathing tube. It's a bit of an art rather than a science, especially when it's coming to complex patients like, the situation your husband has been in. Now, also, have they done a CT scan or an MRI scan of the brain to see whether there has been more brain damage done potentially? Because that is another determining factor whether your husband can wean off the ventilator or not. But here is another determining factor. Let's just say he can wean off the ventilator. He may need a tracheostomy in case he can't swallow or he can't cough, he can't clear his airway. So those are questions you should be asking here. Whether, he potentially can be weaned off the ventilator, but can he actually swallow and clear his airway, i.e. cough? Does he have a gag reflex, right? That, I believe, is very important in a situation like that. Now, also, how many days has he been ventilated for? You haven't shared that. Also, what are his ventilator settings like? Maybe he's already close to extubation. I wouldn't know without knowing his ventilator settings. What are his arterial blood gases like? What are chest x-rays like, right? What sedation is he still on? What sedation was he on? Is he on opiates, right? Opiates, for example, morphine, fentanyl has the side effect of respiratory depression, which means breathing can be impaired with respiratory depression, with opiates, right? So there's all these questions that, we can help you with, but we would need to look at medical records, or I would need to talk to doctors and nurses directly before advising you further. The biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights. And they don't know how to manage doctors and nurses in intensive care, which is exactly what you are dealing with right now. So, that is my quick tip today. I have worked in critical care nursing for nearly 25 years in 3 different countries, where I worked as a nurse manager for over 5 years. And I've been consulting and advocating for families in intensive care all around the world here at intensivecarehotline.com since 2013. And I can confidently say that we have saved many lives with our consulting and advocacy. And you can verify that on our testimonial section at intensivecarehotline.com. You can also verified by going to our podcast section at intensivecarehotline.com, where we've done client interviews. And that's also one of the reasons why we created a membership for families of critically ill patients in intensive care. We have helped hundreds of clients with our consulting and advocacy over the years, including in our membership. And in our membership at intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly, when you become a member, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded that will help you to make informed decisions, have peace of mind, control, power, and influence, so that you can influence decision making fast, making sure your loved one gets best care and treatment. Furthermore, I also talk to doctors and nurses directly. I provide one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, Skype, whichever medium works best for you. I talk to you and your families directly. I talk to doctors and nurses directly. I represent you in family meetings with intensive care teams. I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. And when I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. Also, we do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.